So guys, this is the ECG that you get when a patient of CKD has one banana too many. So certain fruits that are high in potassium can affect a kidney patient and can lead to hyperkalemia, which produce these kind of tall tented T waves. And this can happen in the setting of CKD, Addison's disease, mineral corticoid deficiency, diabetic ketoacidosis, or metabolic acidosis. So let's check out some other changes that are associated with hyperkalemia. So the ECG changes correlate poorly with the levels of potassium and are more commonly seen in rapid onset hyperkalemia. So as you can see here, the first change that we observe is tall tented T waves. The next one is lengthening of the QRS interval and flattening of the P wave, followed by an unusual QRS morphology wherein it merges with the T wave, giving off a sine wave pattern. In some cases, we might get intraventricular conduction block and an unusual QRS morphology. So there are no specific criteria to identify a hyperkalemic emergency, but usually values more than 6.5 are considered dangerous and should be treated promptly. Now let's talk about the treatment of hyperkalemia. So risk stratification and early recognition is important to prevent a fatal outcome. And the first step is stabilization of the cardiac membrane. So this is done by administering calcium salts, either gluconate or chloride. And ECG improvement should be seen within 5 minutes. So we have to repeat the dose if there are no changes seen. And this should always be given along with potassium lowering agents because the protection only lasts for 30 to 60 minutes. So these include insulin and glucose drip, which is the best treatment overall, followed by inhaled short-acting beta-2 agonists and sodium bicarbonate. So sodium bicarbonate is administered only as an adjunctive treatment in patients with hyperkalemia due to metabolic acidosis. So other agents to remove potassium from the body include cation exchange medications, which are for non-urgent lowering, and most effective definitive therapy for refractory hyperkalemia is hemodialysis. So in patients with volume overload, we can make the use of loop diuretics to reduce the potassium levels, and we can even use it at an increased dose in patients with AKI. Thank you. Please like and follow.